Good afternoon. My name is Georgeta Mladin and I'm studying supporting innovation in social and healthcare. And today I'm gonna start talking about one of my assignment. And I've been writing about mental health crisis in health and social care. I'm gonna start with a small introduction in issue mental health crisis, such as common disorders such as anxiety, depression, and PTSD are on the rise. These trends imposes a significant burden on individuals and society. As well, the demand for mental health services is growing, straining healthcare system. Increased incidence of mental health problems. So some of them are anxiety, sadness, and other mental health disorders have increased as a result of modern lifestyle pressure. More people are coming forward for evaluation and therapy as a result of increased awareness of mental health concerns. And the existing mental health issues have been made worse by the COVID-19 pandemic and its after effects. Factor that makes it difficult to get mental health care are economic barriers, including the high cost of care living, limit accessibility for many. Stigma around mental health poses social and cultural challenges to seeking care. The workforce shortage results in limited availability of mental health professional. The factors I think for the stigma is stereotyping. You are blamed for misunderstood and feeling unworthy, as well like labeling, label as being like different, you have a lost identity, or you need to stand out for. As well like social exclusions, which is being avoided, feeling being avoided by everybody else, and discriminations as well. So most of the people are discriminated due to their mental health problems in this society. I'm going to talk as well about the integration of mental health services. Integrating mental health into primary care offers significant benefits, improving continuity and accessibility of care. Collaborative care model emphasizes a team approach, enhancing treatment outcomes. And telehealth solutions leverage technology to reach more patients, especially in underserved areas. As well, addressing mental health services as a common comorbidity of other diseases. Medication available for use easily. Mental health promotion and educational materials, stigma reduction, affordable services accessible to rural poor communities as well. Communication and support between primary care networks and psychiatric specialists, proper training to diagnose and recognize mental health disorders. As well, I'm going to talk about the effect of COVID-19 on mental health care. This pandemic led to stress and heated mental problem as compared to the time before the outbreak. Service disruption due to lockdowns and restriction pose challenges to care delivery. Adaptations like remote counseling became necessary to continue providing support. As well, other effects of COVID on mental health, it's overwhelmed hospitals, the increased waiting times, the staff shortages, as well, the effects are cancellation of the effective procedures. Some people they are like cancel for the surgeries. Some people they are suffering of cancer, they have to cancel their procedures as well. Telehealth adoptions, disruption of supply chains, financial strain on healthcare, and increase of healthcare disparities. So we can say after the COVID there were a lot of effects on the health and care system. Contemporary issues in influencing service improvement, policy changes including new mental health legislation shape the framework for services delivery. Technology adoption such as e-health services, it's transforming how care is accessed and provided. Workforce development focuses on training needs to equip professional with the necessary skills, because I think we really need more professional in this area of mental health, people who knows what to do and how to deal with people with problems. The key perspective is HIT career. HIT career faces challenges like burnout and resource constraint in mental health care delivery. Innovative practices such as holistic care models can improve patients' outcome. Advocacy for mental health policies is essential in shaping better care system. Impact on we're going to talk about the impact on care delivery. Patients' outcomes, both short-term and long-term, are heavily influenced by care approaches. The system efficiency is impacting by resource utilization and care delivery process. As well, equality in care is vital to address disparities in mental health services access. As well, we're going to talk about integration of development. Proposed solutions include policy reforms, technology adoptions, and workforce training. Expected outcomes include improved accessibility to mental health services for all. That means for rich people and poor people as well. Long-term benefits will include more sustainable and integrated mental health care models. The first outcome is telehealth service. Telehealth services, when extended, will help to reach out to more citizens who have no access to other means of healthcare service. Health facilities at the communal level can mean there will be more centers available for mental health care, hence eradicating geographical inequality. The governments, through funding and integration of policy, will ensure that these solutions are expanded across society, integrating mental health services. The second possible outcome is enhanced workforce capability. Offering incentives to attract more mental health professionals into the sector, focusing on workforce retention by reducing burnout and providing better support. As well, encouraging collaboration through multidisciplinary teams for comprehensive care. The possible result, which I think it is public awareness, educational initiatives in schools and communities can foster early understanding and support. So I think a lot of people, they should be trained and support to work in this care. Public engagement through community programs can encourage individuals to seek help, and I think as well the media involvement can promote positive messaging, and as well normalize conversations around mental health problems. So basically, conclusions: these are access to services, workforce availability, and public awareness. Hypothesize outcomes: more access to the service, enhanced human resource capability, and enhanced awareness as well. Thank you very much.